Change is happening. Under the leadership of Governor Andrew Cuomo, New York State launched a 5-year plan to create a better healthcare system across the state. Millennium Collaborative Care is igniting healthcare change in Western New York. Across 8 Western New York counties, a collaborative of healthcare providers, physicians, and community organizations are actively engaged in transforming the delivery of healthcare to the Medicaid community. The focus is on increasing efficiency and value and connecting each patient to the quality healthcare that is needed at the right time. So, what does change look like?
We wanted to make a commitment to change, so our leadership made the decision to move our main office right here in the community, where the patients really are, where the majority of the Medicaid population resides. We were over at ECMC in the high towers in that hospital feel. It just didn't have the right feel, and it didn't really have the right atmosphere to drive change like being right here in the community.
It started with a common belief that all people deserve quality health care. And we knew that in our system, to deliver better quality, that we needed to collaborate and increase integration in a way that we never have before.
Thanks to the innovative communication efforts of the Just Tell One campaign, messages of hope and help are reaching 18 to 25-year-olds across our 8 counties.
Addiction is a serious illness.
The Just Tell One campaign tells an impressive story. From its launch, there has been over 18,000 engaged Facebook users and over 500,000 video views on social media.
Go to justtellone.org to learn how.
One of our biggest changes in Western New York that we've seen is the engagement our patients have with community health workers. So if a patient is having trouble with housing or with finding a meal or child care, anything that may distract them from taking good care of themselves, community health workers help them to seek out the services that they need.
From our southern tier to our northern counties, Millennium Partners are igniting healthcare change where needs are the greatest. We know that sustainable healthcare change should begin at the beginning of life.
At the Priscilla Project, we serve refugee and immigrant women who are having their first baby in America. We match them with a community health worker to provide prenatal education support, doula services during labor and delivery, and breastfeeding support after the baby is born. And what we found is that our women that we serve typically have difficulties accessing services due to language barriers, transportation problems, and cultural differences. So our work that we do really helps the women feel comfortable here. We've been doing these services for about 10 years now, and we've had about 200 women served each year.
Millennium has provided a great amount of capacity for us. They've benefited Priscilla in one way, Polly in another. Priscilla is over 10 years old, so it gave them capacity, it gave them more dollars into something that they were already doing. The Polly Project was not funded at all. We've been in existence since 2013, and it was a strictly volunteer basis and 1 part-time employee. Because of the funding that Millennium provided to us, we were able to hire a full-time community health worker and a part-time social worker, therefore giving us more breadth with the depth that we were already providing to the community.
We've been deliberate about insisting on change because as pastors, probably the one aspect of our work that we would gladly forego is standing over a funeral pyre. And so we determined as pastors that we needed to be proactive and we need to begin to talk about health on Sunday morning, not just preaching the Word of God, but doing health education.
Millennium Collaborative Care initiated a collaboration with the Matt Urban Hope Center to address the healthcare needs of the families they serve.
We open up the building, host those events so that we can try to create change and help change for the people in the community. Your healthcare is also your environment around you. Your health involves a lot of different things, being well educated, having the right information about nutrition and having the access to the proper nutrition. All of those things affect your health.
You'll be able to connect to.
For change to take place, you must deliver the message. The Millennium Healthcare Matters radio show, hosted by Rita Hubbard Robinson, can be heard on AM radio and is streamed over the internet to reach listeners in our 8 counties.
some of the key components to poor health is access to good education, employment.
The National Witness Project promotes patient activation and outreach of the uninsured and non-utilizers of healthcare in the community. This type of outreach has been implemented by our many partners, such as Absolute Care of Dunkirk and Chautauqua Community Health Center. To engage the communities they serve, Millennium implemented the Patient Activation Measure Initiative, which is working to encourage people across 8 counties to be more proactive in their healthcare. But information is key. Over 22,000 participants were questioned to assess the needs and the expectations of the uninsured and underinsured. This provided valuable information to shape and perfect Millennium's mission going forward.
Would you prefer a phone call or a text?
With a goal of reducing avoidable emergency room visits, the Millennium Collaborative Team has created a medical patient care plan beyond the emergency room by implementing patient navigators that assist the hospital emergency teams with connecting patients with the best primary care providers to continue their medical treatment. Simply, Millennium has changed healthcare's relationship to the community. We realize impactful healthcare change must include learning about and respecting all ethnic groups and cultures.
Our healthcare workforce needs support, training, and ongoing education about the importance of health literacy and cultural competency. The patient wants to be able to share their issues with the provider. They'll be more apt to do that if they feel the provider cares about them, understands them, and is willing to work within their cultural norms. That's what healthcare is all about.
The work continues. The change continues. Thanks to the collaborative efforts of physicians, healthcare providers, and community-based organizations, we are making progress in providing access and quality care to the Medicaid community and igniting healthcare change in Western New York. Share your success story and follow our progress at millenniumcc.org.